I'm Joe, and I'm the president of Alpha Delta Nu Honor Society here at the Owens Findlay campus. For our capstone project this year, Alpha Delta Nu decided to participate in Owens' Campus Read program. So we've spent some time reading and reflecting on Sarah Smarsh's book, Heartland. This book gives so much insight into what it's like to work hard and still be poor, to live in a country where you can't afford the basics and can't afford to move yourself into a better situation. This is a great read for nurses to highlight why it is so important for us to recognize healthcare disparities and know what we can do to ensure health equality for our patients. On page 43, Sarah says, "My family's labor was undervalued to such an extent that while we never starved or went without shelter in a chronic way, we all knew what it felt like to need something essential. Food, shoes, a safe place to live, a rent payment, a trip to the doctor, and to go without for lack of money." This is a good reminder that although on the surface a patient may seem to have things together, that does not mean that his or her environment is healthy. She may have a house, but is it safe? He may have access to food, but is it healthy and fresh? She may have Medicaid that covered her trip to the ER, but will she be able to afford the medications that were prescribed to her? Will she be able to take off the recommended amount of time from work to heal properly? These are all questions that we need to ask ourselves in order to recognize our patients' healthcare disparities and come up with ways to overcome them.
Hey guys, I'm Tony. I'm a member of Alpha Delta Nu at Owens, and I'm a fourth semester nursing student. We wanted to talk about the campus-wide reading that we had this semester on a book called Heartland. We wanted to identify some healthcare risks that some of our underserved patients have that they may experience or go through. On page 70 of the book, Sarah talks about the environment she grew up in as a child, how she was around cigarette smoke, fried food, unbuckled seat belts, the glue that was on the walls, nitrates from the water they drank, insecticides, the stress they went through, high sugar diets even, the lifestyle that financially struggling people tend to live, and it puts them at an even higher risk of developing health issues. And yet, they're the ones with the worst, if any, healthcare coverage at all. So we need to educate these people on healthier lifestyle choices as a way to prevent them becoming chronically ill. She also recalls that to make a health concern feel better, they told themselves that they didn't need doctors. But the truth was that they just couldn't afford the doctors. That was the issue, not having the money to get the medical help they needed or preventative care. So I think that it's important that as nurses, we don't get caught up in the notion that everyone has health care now due to the laws that Obama passed. Even though people who have health care plans often can't afford their copays and deductibles. So they're not able to pay for their prescriptions and screening tests because not all that is covered by plans. I plan to always be aware of this, and I want to try and help my patients get the care that they need and deserve, and help them acquire the assistance they need by making things more affordable and helping them find ways to get preventative care, whether it be through community centers or public health means that are free to these sort of underprivileged individuals.
Hi everyone, I'm Marita, and I'm also a member of Alpha Delta Nu and a soon-to-be registered nurse. In reading Heartland, a quote from page 73 stuck out to me. "People like us will face health epidemics that cry for professional care. Obesity, diabetes, methamphetamine addictions, sepsis from what we call a bad tooth with infection at the root, abuse of opioids overprescribed by the same doctors who were supposed to help. The poor lifestyle these people are living due to lack of finances lead to long-standing chronic health issues, and when they finally do seek treatment, they're often given a cheaper treatment option to help with affordability. But when the treatment is cheaper, it's also less effective. Lower-level healthcare plans only cover cheap generics and cheaper versions of diagnostic tests.
Just because a doctor says that a patient needs something doesn't mean they get it. As nurses, we need to be aware of this and the higher risk category that this places our patients in.
Alpha Delta Nu would like to thank Owens Campus Read and Sarah Smarsh for shedding light on what it's like to be a poor child in a rich country founded on the promise of equality, when that promise doesn't seem to include you. We will use our upcoming title of registered nurse to provide a higher quality of care for our patients and to make a difference in their lives.